Hi, everyone. I'm Alana. I'm a massage therapist in Cochrane, Alberta. And this presentation is on vagus nerve self-care skills. So there are a couple of workshop style presentations on the YouTube channel. There's a longer one and a shorter one. The longer one includes these skills, but with a tiny little view of my face. So this is just a little bit better view of that. And if you watch the shorter version, then this is intro to self-care skills for your vagus nerve. Okay, so first of all, a couple of tools that I really like, I find very effective and I do regularly. The key with this stuff is consistency. The more you get at it, the better, because your nervous system loves the consistency. What we do the most, our brain thinks we value a lot. And so it makes that process easier and easier until eventually it becomes very easy to access. And even more than that, hopefully our default. So our goal here is to teach our body to return to its resting nervous system state, that relaxed or parasympathetic drive. And we're just using our body to inform our nervous system that we want to pay attention to that vagus nerve. We want to stimulate it and increase its health and get back into that nervous system state. So vagus nerve basic exercise first. This one is effective and, again, easy. I should say simple. Self-care seems to never really be easy, but it is very simple work. So the way we want to do this is holding our head still. We're going to take our eyes to the side and hold our gaze while we do some nice, deep, relaxed breath. Initially, you're going to want to hold your head still because it is very difficult to stop yourself from turning your head to look to the side. That's reflexive. We absolutely want to do that. And when I watch most people do this for the first time, even when they are holding their head still, they tend to tilt it a little bit to the side. This will be more effective the more still your head is. It's also more effective if you take your eyes as far to the side as you comfortably can, but not straining your eyes. This shouldn't hurt. And for some people, especially if you have concussion or post-concussion syndrome, this tends to make people a little bit dizzy, maybe even nauseous. So of course, if you are dizzy and nauseous, you can stop doing this. You do not have to continue. You can also try, instead of looking as far to the side as you are, try bringing your gaze back sort of halfway to where you were, or just going a little bit over to the side. So you can play around with this to see what feels good to you. The way I like to do this is to put a little bit of gentle pressure on the base of my skull. So I'm my fingers are just hooked into the skin at the base of the skull, and I'm putting a little bit of pressure on there. And then I'm using my hands on the side of my jaw to try and hold my head still. So I'll feel if I try to turn one way or the other, because I can feel that increased pressure on my hand. So I'm going to hold my head, try and keep my shoulders as relaxed as I can while I'm doing this. And by the way, you can do this laying down, standing up, seated is fine. Any position works. I'm going to hold my head still, and I'm going to take my eyes as far to the right as I comfortably can. I'm going to hold them there, and I'm going to take some nice deep breaths, letting my rib cage fully expand, letting that overflow into the belly. So I'm getting good use of my full lung capacity, letting my diaphragm have its full travel. And even this breathing alone is going to help us to come into our relaxed nervous system. I hold my gaze over here to the right until I get a vagus response, which is a yawn, a swallow, or a sigh. Once I've achieved that response, I'm going to go to the left. So I, again, head still, eyes to the left as far as I comfortably can. It's a soft gaze. I'm not straining. This is all supposed to be very relaxed. I keep my breathing nice and full, and I wait for my response on this side. It is often more challenging on the left than the right. That's okay. If you notice that your eyes are drifting back to center a little bit more from the left, it's fine. Just bring them back to the side when you notice that you've come back to center. And what we're trying to do here is mess with the brain's autopilot function. So we really, really want to turn our head to the side to look. It's very reflexive. And when we don't allow ourselves to do that, it causes us to pay attention to our vision, our balance, our proprioception, that knowledge of where our body is in space. And it forces us to pay attention to our vagus nerve. So we get this increase in stimulation when our brain is paying attention to a structure. The interaction with that nerve is increased, and that helps to repair inflammation that might be in there, or just get the nerve working better, because its whole job is to communicate. So if we're increasing its communication, we're getting it healthier. So that's the basic exercise. I highly recommend this twice a day. Morning and night is great, but you can use it multiple times throughout the day. And as it becomes more comfortable for you, use it as often as you notice that you're starting to feel dysregulated. Use it when you're starting to notice a headache coming on, that neck and shoulder tension creeping up, because it interacts the vagus nerve and the spinal accessory nerve, our buddies. So SCM and traps, a place where we keep a lot of our neck and shoulder tension. Those are prime movers of the head and neck. They tend to get pretty jacked up and pretty tense and very headachy. So doing this basic exercise will often help them to calm down. I've also noticed it helps people's suboccipitals to feel better as well. There's a huge vagus nerve cluster right at the base of the skull behind those little skull muscles. So we usually get a good response from them as well. It typically takes a minute each side when you're just getting started with this. So my advice to you is try it multiple times throughout the day. As often as you remember is great. Tie it to a habit if you can, like making coffee, brushing your teeth, going to the bathroom and washing your hands. If you do it all of those times, you'll start to get faster and faster at it. Took me a minute each side when I first started, about that. Now I get my responses in seconds, like 3 to 5 seconds. The only reason I'm not yawning doing the demo for you is because I'm actively suppressing that so that I can keep talking to you. And I notice sometimes just explaining this, I say the word vagus and I think about yawning and I immediately, I'm really want to yawn right now. So you'll get better at it. You'll get faster at it. It starts to become quite a lot more natural. Some people find it soothing right away, which is amazing. Other people find it a little irritating. Like it's hard to do. It's a little bit annoying. If you keep at it, it'll get better. If you hate it, that's fine. There's lots of other ways to stimulate your vagus nerve. So we'll talk about breathing in a second. That's another great way to stimulate the vagus nerve. But another one I really like that's similar to this, but it doesn't involve moving your eyes, is to do a little bit of stretch to the skin at the base of the skull. And all we're going to do here is get our fingers into the tissue at the base of the skull and take one side one way and the other side the other way. Okay, you should be able to see what I'm doing there. So I'm going to take my fingers. I'll explain this facing the camera so you can hear me. I'm going to take my fingers and stack them above each other on the skin at the base of my skull. I'm going to take the top finger and pull out towards my ear, and I'm going to take the bottom finger and push in towards my spine. You can do this with one hand or with two hands, whatever works best for you. So it looks like this. And I just hold that until I get that vagus response, that yawn, swallow, or sigh that can happen. Again, if you're not getting that response, it's okay. You will if you keep doing this, but it's also fine to just say, I'm going to hold this for a minute on this side. I'm going to hold it for a minute on this side, and then I'm going to go on with my day and trust that my body's going to learn this. When I first started doing this work in the massage room, I would always wait for people to get those responses, or I count to a minute and watch for them to get those responses. And for a lot of people, they weren't getting those responses right away. And then frankly, I was getting impatient with waiting because I get easily bored. So I started just checking their musculature. How does this feel? How tender is it? And then I would do that maneuver, or I'd have them do a basic exercise and wait until they seemed relaxed enough, until their breathing had changed a little bit, until they seemed to be settling into it, and then go back and check those muscles again. And what I'm noticing is even when we're not getting our vagus responses, that yawn, swallow, or sigh, most people are still getting some change to their muscles. Some people don't, and that's okay. We keep working on it and we keep finding things that are going to work. But for a lot of people, they're getting change, even though I'm not seeing that objective sign of yawn, swallow, or sigh. Speaking of the sigh we're looking for is called the physiological sigh. And it is a natural sigh that we do regularly throughout the day. We do it when we're going to sleep. We do it when we're at rest. And we do it, the place I recognize it from the most is if I'm crying and trying to compose myself, come back to relaxed. I do a sort of a double intake of breath, right? You can hear it. Kids do it all the time when they're crying, right? That is the nervous system trying to activate that vagus nerve, or it is activating the vagus nerve, trying to get back to relaxed. So it's a natural thing that we do, but we can do it on purpose in order to get a response from our vagus nerve. The physiological sigh actually has a lot of research behind it. Some of those studies show that 3 to 5 physiological sighs performs as well as 5 minutes of meditation in getting us into our relaxed nervous system. And it's really fast. So I love it for that. The way we do it is a double intake of breath followed by a long exhale. We want our exhale to be longer in total time than our inhale time is. I like to exhale through my mouth because I can make it a little bit more forceful, but the inhale, we want to be through our nose. So we breathe in a fairly full breath, and then we get another inhale of breath after that. And that second inhale really forces air into our alveoli, which are those little sacs at the end of the branches of your lungs. And that's where your gas exchange actually happens. So when we really fill them, we're going to get better gas exchange. We're also going to, I don't know why that happened, but I'm just going to keep going. We're also going to get better air expulsion from the alveoli. So we're emptying them better, we're filling them better, we're getting better gas exchange. And then it helps us to change our blood chemistry and get into that relaxed nervous system. So it looks like this: full intake of breath, second, long exhale. So a nice full breath in, almost as full as you can. Second one, long exhale. You'll notice when I'm taking that second inhale of breath that I'm activating a lot of neck muscle doing that, and probably shoulder muscles as well. This is fine for the purposes of the physiological sigh, because we're really trying to drive that air in. We end up using our accessory muscles of breathing. But for your regular day-to-day breathing, we do not want to be activating through the neck and shoulders. We want that area to stay quiet while the whole rib cage expands nicely and we get overflow into the belly as the diaphragm does its full travel. So for your physiological sigh, it's fine if you feel like you're really like getting those neck muscles tensed. But we don't want to associate that feeling with quote unquote good breathing. We want our breathing to be relaxed in other circumstances. So that's that physiological sigh. 3 to 5 times. And again, you can do this repeatedly throughout the day. Anytime you are feeling pain in the body, you're feeling dysregulated, you're feeling nervous or anxious, it's wonderful for all of those things. Okay, a couple of other things here. I want to show the trigeminal nerve massage, and then I'll show a little bit of vagus nerve massage as well that you can do for yourself. So the trigeminal nerve pathway, trigeminal nerve is the nerve that deals with jaw, face, scalp. It's very connected to the vagus nerve. So when we soothe it, we also soothe the vagus nerve. And if we have a lot of inflammation in our trigeminal nerve, it's hard to get as good work out of our vagus nerve. So trigeminal nerve pathway starts underneath the eyebrows here. There's this little notch. If you push up into the brow bone, you can feel this little divot in here. Don't push hard in there. Okay, if you are feeling a little bit achy in there, it probably means that that nerve is inflamed. When I first started doing this, every time I touched here, oh, that's really achy. Now it feels great. I don't get any achiness here anymore. I'd have to push really hard to get achiness. And we don't want to do that. We're trying to soothe. Imagine the nerve is like a hair or a piece of tooth floss underneath your skin, and you're trying to get it to calm down. So pushing really hard on it might feel good temporarily because you're getting a little bit of pain relief by effectively crushing that nerve against the bone and stopping it from communicating with the brain. But crushing a nerve is going to increase its inflammation, and we're trying to do the opposite of that. So really gentle. I do both sides of my face at the same time. I want to get a little bit of work in here. Maybe I'm going to do some circles around. Maybe I'll just take the skin and pull it any direction that it feels good. Really, really gentle pressure is fine in there. But again, no achiness. So if it is achy, you know you're in the right spot. So a little bit of pressure there. And then I follow that bone out towards the temples. I'm going to do that 3 times. My next one is where the cheekbone meets the nose. So this one, same thing. If it's achy, cool, you're in the right spot. But we're not aiming for achiness. So take it easy there. Little circles, spend 5 or 10 seconds here, and then draw the fingers out the cheekbone, again, finishing your temples. You can always do a little bit of gentle massage in there as well if you like. The next point is just to the outside of the nostril. So I'm kind of almost like pushing up against my cheekbone here. And 5 or 10 seconds here, circles, pull the skin, just sit there with a little bit of, again, gentle pressure. Am I saying the same thing a million times? I feel like I am. And then sweeping out the bottom of the cheekbone towards the ear. Ear is very connected to the vagus nerve, so feel free to give yourself a little bit of ear massage at the end of that one. And then the last one is at the chin, just below the corner of the mouth. So what I like to do here is stack my fingers in the center of my chin and then roll out. And I'm putting the most pressure through my pointer finger, but again, gentle. I'm going to hang out here for 5 or 10 seconds, and then I'm going to follow on top of the jawbone out towards the earlobe. Again, 3 times each of those pathways. Why 3? It's predictable. It's soothing to the nervous system. I like to do it that way. So that's the trigeminal pathway. I like to start with that one. I do this when I'm in bed. My hands are clean. My face is clean. I'm just trying to go to sleep anyway. So I might as well take a couple minutes to soothe my nervous system and my trigeminal nerve. And if you're a jaw clencher, this should help to reduce the amount that you clench at night as well. Other points I love for vagus nerve work, right here behind the earlobes, kind of behind the base of the jaw and in below the earlobe. So this, even just like taking that skin and moving it around, a little bit of gentle massage in here. The skin behind the ear, so sliding your finger up and down behind the ear is great. The ear itself, again, very connected to the vagus nerve, so you can massage earlobes, you can massage any of the parts of the ear. I like to take the ear and pull backwards like this. This often feels nice for jaw dysfunction people. And hold on to this, give it, 30 seconds or so. You can also pull down, you can pull up, whichever direction feels good to you, go for it. So a little bit of work here, down the side of the neck, again, really gentle. We're not going to dig into muscles across the front or the side of the neck if we don't know where we're working, because there's a lot of pretty delicate structures in here. And then I like a little bit of work above my collarbone. So I like to kind of poke my collarbone forward and drop my fingers in just kind of behind it. And I'm just to the outside of where SCM attaches. So this muscle that pokes out a little bit while we turn our head, it comes down here and attaches to the collarbone and the sternum. So I'm just to the outside of it. This doesn't need to be super precise. You can run your fingers across the top of your collarbone back and forth. Nothing about this needs to be like an exact spot. There are a lot of nerve structures in here. So again, I'm not digging my fingers in. I'm not trying to do muscle work where I might be trying to activate some pressure sensors. I'm basically just taking the skin and moving it around. It should feel good. It should feel relaxing. So those are my favorite spots: the ear, behind the ear, gently down the side of the neck, and then above the collarbone. There are other great spots you can massage for vagus nerve work. The abdomen's one of them, though that one, you got to make sure you do it properly, so you're going the right direction on the abdomen. The front of the neck has some good vagus spots to it, but again, delicate structures in there. So I'm not going to demo that unless I can see you in person to do that. One of the other things I really love, and this seems a little bit goofy maybe, but you recognize these guys. I feel like we had these when we were kids. I got this at Canadian Tire in Cochrane. It's a scalp massager. The whole scalp is trigeminal nerve pathway for sensory input. So this feels great because I don't have to use my hand to massage my own scalp. So I'll do this. I love this. I can honestly just feel so good. And it is incredibly soothing. It's great for your trigeminal nerve, which again, great for your vagus nerve. So you can use one of these. You can, bribe your friend or your kid or your partner to give you a scalp massage or face massage. That stuff all feels really, really good. Those are my favorites. There's a lot of other ways to stimulate the vagus nerve, which I talk about in those presentations. And if you need somebody else's hands to do this for you, I do a lot of nervous system work in my practice. I have a 30-minute nervous system reset massage that I love doing. It's basically just soothing, gentle work to the front of the body here, around the collarbones, the top of the pecs, shoulders, neck, face, scalp, outside of the jaw. And it's really quite lovely. So if you are interested in more, please don't hesitate to get in touch. I love talking about vagus nerve work and how it could impact the body. If you need work done, absolutely, you can book in with me. I'd be happy to see you for that. And if you have questions, get in touch. I'll throw some contact information up here so that you can reach me. And I hope this works for you. I hope you find it effective. I think I said in the presentations here, but I will say for some people, they notice changes to their symptoms right away. Like week 1, people are saying, I feel so much better. I feel so much more regulated. I'm in less pain. My jaw feels better. I'm getting less headaches. Other people don't. They might notice a little bit of improvement. And then in a couple of weeks, they notice a little bit more. In 3 weeks, they notice a little bit more. A lot of the research talks about sort of the 10 to 12 week mark, where people who don't notice a benefit right away often do notice it around that 10 to 12 week mark. So if that's you, pick your favorite one. It's going to be hard to stick with all of these. So pick your favorite one, do it every day, try and treat yourself really nicely. Keep in mind that we're using our bodies to inform our nervous system that we are safe, that we feel soothed, and it is really effective. So good luck, and let me know how it goes.